So first of all, we want to thank Martha for inviting us to partner and offering this webinar. This is Ellen Bailey. I'm the Falls Prevention Grant Manager at the North Carolina Center for Health and Wellness. So we'll be, along with Martha, offering this webinar on community-based, evidence-based programs in falls prevention and chronic disease management, moving from screening to intervening. So during tonight's webinar, we have the following objectives to share with you. So we're going to be identifying falls risk factors, modifiable and non-modifiable. We'll discuss the need for community evidence-based falls prevention programs. We'll help to identify community-based programs offered across North Carolina to address falls prevention and chronic disease. While doing that, we'll review the most recent evidence-based research on the effectiveness of evidence-based programs. We'll identify ways that physical therapist assistants, and community-based organizations can partner, and describe the continued competency opportunities for PTs and PTAs with certain community-based fall prevention programs. And we are providing all this information through a lens of best practices and sustainability, and we welcome you to explore the research, the tools, and the resources that we describe in the webinar. So here's a little bit about who we are and why we're here.
Well, wonderful. This is Jeannie Dairagi, and I'm the grant manager for the chronic disease aspect of the work that we're doing. This Healthy Aging NC initiative was initially established in 2016 to really address aging across the state, and in particular the fall risk and the chronic conditions that accompany aging. As you can see, the Healthy Aging NC team is currently composed of 4 full-time staff members. Our director, Nicole Miller, on the left is based out of Raleigh and focuses on more of our statewide collaborations. On the right is Janice Self. We love her. She's our data administrator guru. And then Ellen and myself are the grant managers, and we're in the middle. Our executive director is Dr. Amy Lanu. And as it states, we focus on being a statewide resource for evidence-based programs and healthy aging. And we do that through connecting programs, agencies, supporting the capacity of providers to offer the programs we'll be talking about. And we do have a website, and we offer different data reports. So how we got our start is that we really followed up on the mission of the NC Center for Health and Wellness, which is to develop equitable opportunities that lead to healthy North Carolina communities. So in this context, we're using the definition of health equity as the highest level of health for all people. And in particular, we have found that as we age, there are natural disparities and inequities in how we're treated around our health and how we're treated in the healthcare system. So the Healthy Aging NC initiative is really working to address these health inequities, and we do that through leveraging our collaborations with the Aging Network, in particular the area agencies on aging and senior centers, and we're connecting them with expanding audiences and through the promotion of these evidence-based health programs. So what are our overall goals at Healthy Aging NC? Is really to embed evidence-based programs and systems across North Carolina. We want these programs to be as accessible as prescription medications. And we really want to improve the quality of life for older adults and meet the triple aims of healthcare: better health, better healthcare, and lower healthcare costs. And it's really important to note that we're not in competition with other programs. We're not providers of these programs. We work to collaborate, support, and expand them across the states. And in addition, the majority of the programs we'll be discussing don't cost a fee to the participant or require any type of membership fees or agreements. And I wanted to let you know that we are funded by a variety of different sources, including federal grants. The top one he mentioned on this slide is the Centers for Disease Control and Prevention. This is a 5-year grant that works to address the impact of the chronic disease of arthritis. And a main strategy of this grant is to increase the amount of counseling and referrals of patients to physical activity and to self-management programs. Other strategies include promoting walking and raising awareness about arthritis. So these strategies all complement other ongoing treatment options.
And we also have a 3-year grant from the Administration for Community Living, which is the U.S. Department of Health and Human Services, to reduce the risk of falls and also expand evidence-based fall prevention programming across the state of North Carolina, and also to create a falls prevention referral pathway specifically in Western North Carolina, which I'll talk about in just a little bit. So why are we here? What is the need for evidence-based programs around falls risk and chronic conditions? So here's our great state of North Carolina aging map. Some people are referring to this as the silver tsunami. As you can see, the darker counties are counties that as of 2017, there's 78 of our 100 counties have more people over the age of 60 than under 17. And by 2037, that will be 94 of our 100 counties will have more people over the age of 60. So overall, North Carolina ranks 9th nationally, both in total population and also in the number of people 65 and older. So a little background on who are the 65 and older people in our state. So you can see from this slide that a little over a quarter of older adults live alone, and that's especially important to consider with falls risk. Additionally, given the median household income for older adults, it's helpful that most of the community-based programs that we'll be sharing today are offered at no or low cost. Most adults in North Carolina are community dwelling. Most older adults in North Carolina are community dwelling, which is essential to keep in mind, that especially when many live alone and need access to services and programs. 24% of North Carolinians over 65 have an ambulatory difficulty, and 15% have difficulty with independent living activities. So that was just a little background on who are we talking about when we talk about older adults in North Carolina. So let's look now at the burden of falls. This is data from 2017 shared by the North Carolina Division of Public Health. Falls continue to be the #1 cause of injury death among 65 and older. And on a daily basis in 2017, which is the most recent data set that we have, there are more than 3 deaths per day due to falls, 68 hospitalizations, and over 547 emergency department visits on a daily basis. And these are the reported falls. And as many of you know, there are lots of falls that go unreported. So this is a map that shows by county in North Carolina the rates of unintentional fall deaths. The Division of Public Health, again, the Injury and Violence Prevention branch, helped to create this map. And this map showing this disparity helped to secure the falls prevention grant that we currently have to build capacity for evidence-based falls prevention programs across North Carolina, and to create a referral pathway specifically in Western North Carolina, where you see we have some of the higher rates. So given these unintentional fall rates, let's look at some of the risk factors for falls. So the CDC identifies the following non-modifiable risk factors: advanced age, being over 80, a history of previous falls, especially with injury, and also medical conditions that might limit your ability to get around, such as Parkinson's or stroke, and also conditions that cause confusion, such as dementia or Alzheimer's. So some of the modifiable risk factors identified, which many of you may have already seen in clinics, are lower body weakness, some difficulties with walking and balance, polypharmacy, meaning the use of more than 4 medications at a time or taking psychoactive medications, vision problems, which includes lighting, foot pain or poor footwear, and of course the home hazards. There are some additional risk factors, such as fear of falling and using an assistive device incorrectly. So when considering that a previous fall, as we saw here, increases risk for future falls, I want to briefly mention the STEADY toolkit. So STEADY stands for Stopping Elderly Accidents, Deaths, and Injuries. Many of you may already be familiar with the STEADY toolkit and the algorithm, but I'd like to introduce it briefly for those of you who may not have seen it. So researchers at the CDC's Injury Center created this toolkit for healthcare providers who treat older adults who are at risk for falling or who may have fallen in the past. So the STEADY toolkit is based on a simple algorithm adapted from the American and the British Geriatric Society's clinical practice guidelines. The toolkit includes some basic information about falls, case studies, conversation starters, how to talk to patients and caregivers about falls, and also standardized gait and balance assessment tests with instructional videos already made for you. They also provide educational handouts about fall prevention designed for patients and caregivers. And you can find a great set of resources at the link here at the bottom of the page. This is a little bit hard to see on this screen, but this is the STEADY algorithm. And just wanted to make sure that you know that the CDC will be updating this this year. So keep an eye on the CDC website for updates. And also the Academy of Geriatric Physical Therapy will be highlighting the STEADY in a 3-part series in their Geri Notes clinical magazine of how to integrate STEADY into physical therapy practice. So I also wanted to just mention with this study again, sorry, that this helps with low, moderate, or high risk screening. So if you have time later to look through it on your own, you can see how it works out into the low, moderate, and high risk on the right.
Oh, so we've been talking a bit about falls and fall risk in these past slides, but as mentioned, a really important aspect that contributes to falls is the presence of chronic conditions. So we're just going to take a moment to describe some of the impacts of chronic conditions on fall risk. And the CDC defines chronic disease pretty broadly as any conditions that last at least 3 months and require ongoing medical attention, limits to the activities of daily living, or both. In general, chronic diseases can't be prevented by vaccines or cured by medication, and they just don't disappear. Here in North Carolina, for people 65 and older, it really mirrors the chronic conditions expressed in this graphic by the National Council on Aging. We find that 81% of North Carolinians 65 or older do have at least one chronic disease that they report, and over half of them, or 51%, have 2 or more chronic diseases. In particular, I wanted to take a moment to focus on arthritis. So as you know, arthritis isn't a single disease. It's really an informal way of referring to joint pain, joint disease, and there's more than 100 different types of arthritis and related conditions. And often we find that the common symptoms of arthritis, the swelling, the pain, stiffness, decreased range of motion, it really impacts a person's normal activity, strength, and fall risk. We find, as you can see in this graph, that over 2 million adults here in North Carolina have arthritis, with the rates increasing as adults age. And related to this, a recent study came out by the United Health Foundation on America's Health Rankings Senior Report, and it ranked North Carolina as 50th in arthritis management. That is the lowest ranking that North Carolina can get.
We have a lot of work to do.
We have a lot of work to do. And especially when we look at arthritis, it's important to note that about half of adults with heart disease or diabetes also have arthritis, as do 1/3 of people who are obese. So really increased pain, fear of pain, lack of knowledge of safe forms of physical activity can indeed make it harder for people with arthritis to be physically active and healthy. So the evidence-based programs that we'll be describing can directly address these issues in order to improve disease management and really to help improve safe physical activity. Continuing with the whole idea of chronic conditions and their impact on fall risk, there's 3 cited studies here that demonstrate the reciprocal nature of these two conditions. And the bottom line is that the presence of chronic diseases such as circulatory disease, diabetes, chronic obstructive pulmonary disease, even depression and arthritis are all associated with increased odds of falling. And in addition, falls contribute to chronic conditions, for example, with TBI or traumatic brain injury.
Just gonna have to settle right there.
So we know that you're very familiar with the need for movement, and I think what you're doing. Okay. We know that you're very familiar with the need for movement and physical activity, but we wanted to share some details of the research behind these evidence-based programs.
So where and how can we intervene? How can we move from screening to intervening to address fall risk and chronic conditions? So in reviewing our previous slide of the modifiable risk factors for falls, there are several areas highlighted in bold here for successful intervention within the clinical PT setting, as you know, and also in the community setting as well. The CDC has also stated that effective clinical community interventions focus on improving physical activity and exercise, muscle strengthening, gait and balance training, and also they can support with in the community, particularly fear of falling, home safety and environmental checks, referrals that can be made for medication review, footwear, vision checks, and chronic conditions, chronic conditions. And as we talk so much about physical activity, feel free if you need to during the webinar to get up and stretch, walk in place, whatever feels good.
And we wanted to especially highlight the Physical Activity Guidelines, second edition that was recently released. And it's a really nice summary of the health information related to each type of age group. And really the bottom line is that being physically active is one of the most important actions that people of all ages can take to improve their health. And it's important for people to realize that these health benefits start immediately after exercising, and even short episodes of physical activity are beneficial. So once again, all the evidence-based programs that we'll be talking about really teach safe, manageable ways to begin and safely increase physical activity.
So the U.S. Preventative Services Task Force has also emphasized the importance of exercise and interventions to prevent falls in community-dwelling older adults. So they examined 62 randomized clinical trials, over 35,000 participants, and 7 different fall prevention intervention types. They focused on the most common types of interventions in this review, multifactorial, exercise only, and vitamin D supplementation. And they found that those addressing multiple factors and exercise were the most effective, and the evidence was most consistent across the fall-related outcomes for exercise. In an additional study, another comprehensive review of evidence-based fall prevention programs nationally looked at 8 different evidence-based falls prevention programs, over 45,000 participants. And they looked at these in a variety of sites and in both urban and rural areas. And what they found was that we need to continue to offer sustainable technical assistance for these evidence-based programs, and we need to develop scalable clinical community referral systems to increase fall prevention program participants among rural dwelling older adults. And this is especially important in North Carolina, as many of you may know. The U.S. Department of Agriculture has many definitions of rural, but around 40% of North Carolinians, approximately 4 million people, live in one of the state's 80 rural counties. That's 80 out of 100 counties.
Oh, wow, that's pretty striking for North Carolina. So in addition to the effectiveness of exercise intervention, I do want to put in a plug for the self-management programs. They've also been deemed as effective. And these two resources, one is from the Interagency Pain Research Coordinating Committee. This was created by the Department of Health and Human Services, and it endorses self-management programs as improving quality of life. The second link demonstrates the CDC and how they state that self-management programs are proven to reduce symptoms and improve quality of life.
So how and why? How can we support and encourage partnerships between physical therapists, physical therapy assistants, and community-based organizations? And why should we be doing this? I wanted to share with you that the National Council on Aging and the Academy of Geriatric Physical Therapy is creating a memorandum of understanding. This is going to be launching this year in 2019. And the goal of this initiative is to educate PTs and PTAs to build better connections. Connections on the benefits of community evidence-based programs, working with aging service organizations, and physical therapy partnerships. They'll be sharing information. The first article will come out in Jerry Notes in July of how to create effective partnerships and also how to make the business case for these partnerships, such as care coordination, reimbursement for evidence-based programs that are held in PT clinics and prescribed by PTs, what are value-based payments and how you can incorporate those. So more information on this partnership and MOU will be forthcoming from the AGPT. So keep an eye out for those. This is the website, as many of you may be familiar with already, geriatricspt.org. You'll find updates and announcements here, along with the updated study tool for PTs in the near future. I also wanted to highlight the Move Forward section of the APTA site. They have some great references and guide to falls for PTs. And this is also where there was an article posted from 2016 called Extending Adherence. And Dr. Plack stated in this article, it's a great article, I highly recommend it. She stated that, quote, the building blocks of post-treatment adherence are laid during the initial physical therapy treatment sessions. And she also explained some programs they're working with and added that, quote, the socialization piece is a great way to enhance adherence. So how can we take all of this information into consideration as we develop and strengthen these partnerships in North Carolina? So what is the benefit to you as the PT or PTA and to your patient and to the community organization? So we are not PTs or PTAs, and Martha can address these programs from the PT perspective in the second part of the webinar, but we've interviewed many PTs and participants in these programs, partners in community-based organizations, and have done some research to come up with this initial list as a starting point. So community-based, evidence-based programs are not in competition with physical therapy at all, but they can provide support to you and to the patient in a variety of ways. And I think that's why the AGPT is partnering with the National Council on Aging to create this MOU. So for example, considering discharge plans at the very first visit, and how might a community-based program support your patient in the long run? As part of your intervention plan, you can refer low or moderate risk, fall risk patients to strength and balance programs or hold them in your practice. Some of these community-based programs include an exercise component that could possibly support adherence to the home exercise program that you prescribe, perhaps motivate the patient to maintain the progress that they make after discharge. Additionally, they could help patients achieve and sustain their physical activity levels, helping them to meet the recommended physical activity guidelines. PTs and PTAs can offer group programs within the clinical setting or within the community setting, or you could refer out to those. Additionally, evidence-based programs in the community, such as the ones that Jeannie are going to talk about later, can help a patient to manage chronic conditions or diseases that may impact their progress with you while they're under your care. These group programs offer the opportunity for socialization, which helps with adherence. And certain programs, like A Matter of Balance, which we'll talk more about in just a minute, can help if you need to refer someone for a fear of falling or for a home safety review that you may or may not have time for in a home health setting or in the clinic. These programs also offer you an opportunity to volunteer in community-based programs, and Martha's going to go into that in detail in the second part. And these community-based, evidence-based programs also help patients connect with other services that they may need. So this is just an initial list. So we look forward to hearing more from you towards the end of the webinar after we've shared more about the different programs that are available, that what will work for you.
Whew, okay, so that was a lot of stats and facts and research. So if everyone could just take a deep breath, and we're going to switch gears a little bit and talk a little bit more about evidence-based programs. And we really, a purpose of this webinar is we would like healthcare providers to know about and refer to these evidence-based programs. And we really feel that you as physical therapists and physical therapist assistants are an especially important aspect of the healthcare continuum. So we really appreciate you listening to this and being interested in this information. We keep mentioning this term evidence-based programs, and we just wanted to let you know that it's encompassing programs that are based on a rigorous study, that have documented effects, and they demonstrate reliable and consistently positive changes in health in particular, but also different functional measures. In addition, all of these programs have been translated into very practical, effective community-based programs. It's a packaged curriculum with a variety of supportive materials. So it's set up so that the content and the fidelity will be consistent in all settings across different populations, and it will be easy to deliver. So that is a big reason why evidence-based programs can be an efficient use of available community and healthcare resources. And again, they're meeting the triple aims of healthcare, the better health, better healthcare, and lower healthcare costs. So we're going to describe in detail 5 of the evidence-based programs that the Healthy Aging NC Initiative supports for the state of North Carolina. So why these 5 programs? They have been implemented in North Carolina for a period of time. They're accepted by the area agencies on aging and the Department of Aging and Adult Services through Title III funds, and they are supported through our federal grant funding. These programs, and we'll mention this later, but they are listed on our healthyagingnc.com website, and we're able to promote trainings and material support with them. So this beautiful graphic that Ellen put together gives you an idea of the flow and the possible continuum of how these programs are related. So you can see at the top with Otago, that's for more of the higher risk, more frail patients. And as you go down, more people can access the more active programs. Now, you might notice on the side it says the chronic disease self-management programs. They can be taken at any time and can complement these other evidence-based programs.
Okay, so now we're going to jump into some of the details of the programs, which you're probably been curious about. So we're going to start with Otago, and I want to give a big thanks to Tiffany Schubert for granting permission to share the information on these 2 slides, and she's also the one who shared the information about the national initiative, the MOU, with the AGPT and NCOA. So Tiffany is based in North Carolina, so we're fortunate that she's located here in North Carolina, and she is the national consultant for Otago. So Otago originated in New Zealand, but this is the US implementation model. It's a structured and progressive balance improvement program. It can be offered and implemented in the home or a community setting. It does need to be implemented by a PT who oversees the progression of exercises. So the details are here. I want to highlight here, Tiffany wanted me to emphasize that this is where fidelity is really important with the warm-up exercises, the 17 exercises that are included in Otago that include the use of resistance and weights, and then also a walking program is included as well. So Otago was selected by the CDC as an evidence-based fall prevention program in 2010. There is an implementation guide that shows all of the exercises and explains how the program works. Online training is available through UNC, and the link is active here when you get the webinar afterwards, and the training is $35. And as I said, Tiffany, if you go to this link and explore it a little bit, if you have any specific questions, she's more than happy to help. And I know that Martha's going to be talking about CHAMP later, and that Otago is also used in the CHAMP program. So the next one we're going to talk about is a matter of balance. So the core elements, this is actually, before I jump into that, this is the most popular program in North Carolina. This program kind of sells itself based on recommendations from participants. It's led by 2 trained matter balance coaches. They have to follow the curriculum for fidelity. The class meets for 8 2-hour sessions that can be offered once a week for 8 weeks or twice a week for 4 weeks. Class size is usually limited to 12 maximum, because often in matter balance there will be participants who are using an assistive device, so just to keep a small, safe size. And there's also a guest health professional visit that is part of the matter balance curriculum, and that's often when a PT or a PTA comes into the class and works with the participants and explains how to get up if you fall, how to safely fall if you know you're going to fall. So this is also a great way to participate in a community program and learn about what this program is like if you're interested. Part of the curriculum includes a lot of problem solving and discussion. There are basic gentle strengthening exercises that are included. Participants learn how to be assertive. They learn how to check their home for fall hazards and learn some home safety tips, and also learn fall prevention strategies. A matter of balance, so I mentioned Otago first is really the most frail. A matter of balance would be the next best class for someone who has sustained a fall in the past or has some concerns about falling. If you have a patient who's starting to restrict activities because of concerns about falling, this might be a good fit. It's adapted and designed for people who are 60 and older and able to problem solve. So in order to become a matter of balance coach, you need to attend an 8-hour coach training led by a master trainer, and there's a brief teaching demo that happens during the training. This training is often free if you teach with your local area agency on aging. In order to maintain certification, you need to teach twice in 1 year, and there's usually an agreement on submitting the paperwork and data collection and the posting of the workshop with the Area Agency on Aging and Healthy Aging North Carolina. So master trainers, to become a master trainer, you need to go through a 2-day training, and the cost is a little over $1,500, and that often can be shared with an agency, and you can partner with agencies to hold the license to train coaches and lay leaders. So here's what people say about the matter of balance classes. So 96% feel more comfortable talking with others about their fear of falling, which is really important to be able to talk with people about that. 96% are more comfortable increasing their activity after taking a matter of balance, and 91% have made changes to their environment as a result of the class. And I've included the link here to Maine Health, which includes all of the information about the curriculum, becoming a coach, and also a master trainer. On the right-hand side here, you'll see this is North Carolina specific data. So 90% of the people who have completed this class in North Carolina have reduced their fear of falling. And I also wanted to share that Cho et al. Also did some research on a matter of balance and found that gait speed improved from baseline to post-intervention, and that there were significant changes in tug scores, timed up and go, observed in participants living with others. So again, that socialization piece is important. The Center for Medicare and Medicaid Services did a report and review of a matter of balance on the return on investment. And I just wanted to highlight, we can see that it lowers the financial cost, but I also wanted to highlight these outcomes. They found increased physical strength and activity, so better health outcomes, and also better care. That participants were more likely to use physical therapy, to access physical therapy, to communicate And it also, participation was correlated with reduced mortality rates, which is huge finding. So this slide shows, these are all the participants in our falls prevention workshops over the last about 2 years, year and a half. And you can see here that of those participating in falls prevention workshops, this is a matter, balance, and Tai Chi, that arthritis is the top chronic condition that most of them list. So you can see that more than half of those in North Carolina also have arthritis. And so Jeannie's going to talk a little bit about an evidence-based program focused on arthritis.
So we are journeying down that graphic, that triangle of the highest risk down to the lowest risk people. So Walk With Ease is a program that's about in the middle. It was developed by the Arthritis Foundation, and it's designed for people with arthritis or joint pain, and it's really set up nicely for individuals who haven't been physically active. And there are 2 versions of the program. There's something called group led. This is led by 1 to 2 trained facilitators. It meets 3 times per week. So it is a commitment for 6 weeks. And each session is anywhere from a half an hour to an hour. It all depends on how long the participants are able to safely walk. It's for a smaller group, and the sessions consist of a lecturette topic, which is a basic information, but the key aspect of these programs is that there's a warm-up, a stretching, a walking, a cool down, and a stretch. Now, the self-directed version is basically encouraging people to walk on their own, but with the guidance of 1 to 2 trained facilitators and support through online or emailed resources. And we definitely encourage people leading a self-directed version of Walk With Ease to have optional or perhaps once a week in-person walking sessions so that the different stretching and information can be explored. Now, this aspect can really vary. Any number of people can attend because you're not always meeting. Now, Walk With Ease is for people who really are focused on their discomfort and pain from arthritis or any type of joint pain, and they really want to have confidence again, feel better, and increase their balance and strength. And as I mentioned earlier, each session consists of a brief topic related to walking and health and arthritis, and then there's a warm-up, stretching, and the same stretches are used every time so that people become very familiar with these exercises and will just use them by rote. And there is a Walk With Ease guidebook that accompanies the participants. So how does someone learn to be a leader in Walk With Ease? This is actually the only leader training that is done completely online and can be done by an individual from their own computer, their own home. It basically requires watching 3 videos, going over the leader guidebook, and then there's a brief multiple choice exam. One thing with this Walk With Ease program is they do need to have a current CPR certification, and we do ask for them to post their workshops and collect paperwork, and that can all be explained to the individuals as they get trained. It is a CDC recommended program, and a randomized clinical trial did find that both the group and the self-directed versions of Walk With Ease were helpful to people. And as you can see, the different areas that were improved are listed on this slide. So how did this research happen? Well, we're very fortunate that the main researchers at Walk With Ease, Lee Callahan and Mary Altpeter, are actually located here in North Carolina at the UNC Thurston Research Center. And they're also leaders of the Osteoarthritis Action Alliance, which is a national agency. So both of these agencies are wonderful resources for us here in North Carolina. And you can see the outcomes of their research. Decreased pain, stiffness, fatigue, disability, with an increase in strength, balance, walking pace, and confidence.
So this same team, Lee Callahan and her team, also looked at the effectiveness of the Tai Chi program for people with arthritis in the community. and noted with respect to falls that balance by reach also improved significantly. So we're going to talk a little bit about falls prevention through Tai Chi. The Tai Chi for Health Institute created a specific form. It's a Sun style of Tai Chi, the specific form called Tai Chi for Arthritis and Fall Prevention. So the core elements of this program are that it's led by one trained instructor. It meets for 20 one-hour sessions. Class size is limited to 25. And those, you can organize those sessions once a week for 20 weeks or twice a week for 10 weeks. And so the fall prevention benefit has been found after 16 hours of participation in this program. So each session consists of a gentle warm-up, so stretches for each major part of the body from your neck down to your ankles, as well as a cool down. 1 or 2 movements are introduced per lesson, and they progressively lead to completing the 6 basic core movements and 6 advanced movements. Participants also learn breathing techniques and Tai Chi principles, including those relating to improving physical and mental balance. So a lot of mindful moving, how to transfer weight is a big part of this program, this curriculum. So Tai Chi for arthritis and fall prevention is ideal for adults with or without arthritis or musculoskeletal conditions. Anyone with any type of joint pain or back pain would benefit. And also it's great for those who are at a moderate to higher risk of falling who do not have arthritis. So the research has shown that Tai Chi for arthritis and fall prevention can improve balance, increase muscular strength, improve mobility and flexibility, in addition to psychological health, which a lot of that comes through the breathing and the mindful movements. It can decrease pain and prevent falls. So in order to become an instructor and with this curriculum, you would need to attend a 2-day training. The cost ranges depending on who's offering it and where, between $250 to $300. If you're in Western North Carolina, then please contact me. I'll have my contact information at the end of the slide. We have a grant supporting instructors in Western North Carolina for the next year. Instructors need to maintain board certification with the Tai Chi for Health Institute, including an active CPR and first aid certification. Need to offer 1 class per year for 20 sessions and complete recertification every 2 years. So some of the research and the evidence behind this curriculum. The Cochrane Review of Tai Chi looked at over 79,000 participants and 159 studies, and it supported beneficial effects of Tai Chi versus other forms of intervention for reducing the rate and risk of falls. It's found to be highly effective for those at moderate risk for falls and less for those at a higher risk for falls. The Sydney Tai Chi trial had 83 of the participants in this trial were participating in this particular curriculum, and they reduced recurrent and new falls by 67%. So we're going to look at how chronic disease self-management programs can complement falls prevention.
And I am wondering, as you're listening to the details of these programs, if you're envisioning any of your patients that might be a really good fit for any of the programs. And indeed, the chronic disease self-management program is a little different than the more exercise and physical activity-based programs. It was originally developed by Stanford University, and it's branded Living Healthy here in North Carolina. Now, the overall framework is the same for the programs, but they have different topics. One is for chronic disease of any type. Anyone with any form of a chronic condition can attend, but then there's also a program that focuses on chronic pain, one that focuses on diabetes, and then there's Spanish language versions of all the programs. And the programs do focus on management of symptoms. They meet once a week for 6 weeks. And it's a 2.5-hour session. And before you think 2.5 hours, I promise you that it's made up of different activities, different components. There's group interaction. So that 2.5 hours really does go by quickly for the small group. It is led by 2 trained facilitators, and it's really a focus on skills and techniques that increase a sense of self-efficacy. So there's skills mastery. For example, they have the participants practice behavior-based action planning so that people can try out new things. There's modeling, not only from the leaders, but from their peers in the program. There's a reinterpretation of symptoms, and there's persuasion, really encouraging and motivating people. And the main foundation of the self-management program resides in an exploration of the symptom cycle. That's the graphic to the left. It's the concept that one symptom can then lead to a series of other symptoms and problems, which creates more symptoms and problems. So the toolbox, the graphic on the right, is the different techniques that are shared with the participants to really break the symptoms cycle. And you could see on the box, there's everything from learning about physical activity to learning how to breathe to communicating with your loved ones as well as healthcare providers. Now, this training to become a leader, it's pretty intensive. It's 4 days, but it's really nice because there's a lot of mock trainings, presentations, a lot of feedback so that every leader is very comfortable with the curriculum. And then they are required to lead at least 1 program every 12 months. And and there is a license, just like with a matter of balance, there is a license with a cost, but it can be shared with other agencies. So I wanted to put, this is the original research that took place through Stanford University about the effectiveness of the self-management programs. They're older, like I mentioned, but the bottom line is really subjects who took the program have improvements in exercise, cognitive symptom management, general health distress goes down, fatigue goes down, on and on and on. And most importantly, there are fewer days in the hospital spent and fewer outpatient visits and hospitalizations. Now, there was a more recent study that was done just last year, and this was applying the chronic disease self-management program in a worksite setting. And they also found the program was effective. In particular, there were improvements in sedentary behavior, patient-provider communication, fatigue, and physical activity. So just again, as a matter of balance was done, CMS did a return on investment study, and they did find for every individual who goes through this program that there's lower costs and there's better health.
This is Ellen. I want to go back. I misspoke, I think, just briefly, and I want to go back and highlight something about Tai Chi for fall prevention. So I wanted to make sure that it's clear here that Tai Chi is best for those at low and moderate risk for falls. Here, where it talks about participants, it's for those who may not have arthritis but are at risk for falls. So your higher risk patients would not start out with Tai Chi. So I just wanted to make sure I clarified that before we moved on.
Well, excellent. All right, so as a part of this webinar, this PowerPoint, Ellen and I have reviewed the need for these evidence-based programs here in North Carolina. We've described in probably more detail than you wanted all the programs and their research that support them. So hopefully you're excited about these programs. You may or may not already be trained in them or refer to them, but we really want to encourage you to take the next steps with the information. And so we wanted to really share resources and support that are available to each and every one of you. Now, first of all, we do have this Healthy Aging NC.com website. I feel like it's our baby in a way. This was really when we established the Healthy Aging NC initiative, it was important to have this. And this particular website, it posts all about the programs and trainings, talks about their locations, when they're taking place. You can even register online. And in addition, we've got tools and resources, testimonials, and it's mobile friendly, so you can have it on your phone and show your patients. We really do welcome you to check that out. And we mentioned that we really leverage the Aging Network. So this is a map of the 16 area agencies on aging. There are base agencies that we work with, and the different colors represent the counties in each AAA region. Now, we definitely don't only work with the area agencies on aging. We welcome partnerships. We work together on website information, regional meetings, coalitions. We work on low-cost trainings. We develop resources and toolkits. So we are very open to, again, partner without competition. We really want to align and make all of these programs as accessible as possible. And in fact, we are holding a statewide summit on chronic pain and musculoskeletal disease next Friday, June 7th. If this might interest you, just put your name and address in the chat box and I can send the information to you.
Okay, we're gonna go through some of the details of the website. So when you get a copy of the webinar, these are active links, and I'm going to show you a little bit about how the website works and what you can find there. So bear with me while I go out here to the website. So this is our live website. I encourage you to check out under programs. You can find detailed description of the different programs. So for example, under falls prevention programs, if you click on there, we have a one-page document that lists, it's like a program menu of all 4 falls prevention programs in North Carolina, or the 4 that are on Healthy Aging North Carolina. So that can help you decide maybe which one is the best one for your patient. So say, for example, you have someone that would be a good candidate for a matter of balance. You could just pull this website up, look at register for a workshop, and it'll show on the map where some of the classes, the current classes, are located. So for example, in Winston-Salem, there's a class that started in April, ending pretty soon, and that you could, if you click on that, you find all the links to where it's, all the information, where it is, what time, the contact information, who to call, the time, and dates. Okay. You can also find a program. You could enter a zip code and search for any programs near you as well. So that's available for the YMCA programs, for Moving for Better Balance and Enhanced Fitness. That takes you directly to the Y Alliance website. And the Otago exercise program, as I mentioned, since that needs to be led by physical therapists, there's a specific website for that here listed on our website. So I want to show you as well, we have some testimonials, and if you go under About and Healthy Aging Stories, you can read about some participants who have been through these programs. So this is, for example, is a Walk with Ease testimonial, how it's helped them, what they've learned. We have some for Tai Chi for arthritis and falls prevention as well, so you could share these with your patients. Under resources, we have a variety of resources listed. We try and keep it up to date as possible with healthy aging news. If you'd like to become a leader, you can go under leader info and look under leader trainings. And there you can see upcoming, and these are updated daily. So whenever we get news of a training in the state, a lot of the trainings happen in the spring and fall, right before most of the classes are starting. But here you can see that there's a Matter of Balance training coming up, a Living Healthy with Chronic Pain Leader training up, so coming up. So this is a great place to find leader trainings. And also, if you're looking for a program for a patient or a leader training for yourself and you don't find one currently happening once you've checked out the map and the dates, please go to the contact button and fill out exactly what you need. So you could enter your name if you're looking for a leader training, or if you have a question about something for a patient. You could enter a patient's name if they give you permission. And then if there's not a class in their area, we make sure to forward that on to the area agency on aging in their area. And they usually keep a wait list of people who are interested in upcoming programs. Is there anything else, Jeannie, need to make sure to show on the web page?
No, that was good.
Okay. So again, these links are active, and this will be shared with you afterwards, and you're welcome to explore the website on your own. So next steps. So what can I do now? So here are just some suggestions, and we look forward, as we said, to your questions at the end of the webinar. You can visit the Healthy Aging North Carolina website, look at the program menus, look at the program details, so you have a good idea of what is the right program for my patients, or what program would we like to offer in our clinic, and you can refer patients directly to these programs. You can get trained to lead an evidence-based program, and Martha's going to talk in detail about that. You can connect with your local area agency on aging. You could be a guest health professional for a matter of balance, and kind of, it's the favorite class of the participants when the physical therapist or the PTA comes to the class, and that could also give you a good sense of how these classes operate in the community. And then you can contact us if you have any questions. We have our email and phone numbers here, and you can always use the contact us form as well on the web page. So we are going to turn this over to Martha Zimmerman at this point, and she's going to continue the second part of the webinar.
What I'm going to be looking at, how can you earn CEUs and for evidence-based programs, and then looking at some of the ways to make referrals. Okay. And good news is that just a couple weeks ago, North Carolina Physical Therapy Association awarded the approval for CEUs for the coach training for a matter of balance, which is 8 CEUs. Typically, there's no charge for that course, but you are expected to teach at least 2 classes each year, and that would be, let's see, so it would be 16 hours per class, and then you do that twice, that's going to be more than 20 hours, so you could earn an additional 1 point, because you can get 1 point for 20 hours of volunteer. So just to let you know how you could do that, you need to go to the NCPTA webpage and go under practice, and it should come up falls prevention SIG, and you click on the falls prevention SIG, and then you go to group page, click on that. It's going to come up falls SIG material. When you click on that, you're going to find what I've just told you about the A Matter of Balance coach training being approved for CEUs. That's that first document that you can download. The next document is an Excel spreadsheet of all the A Matter of Balance master trainers in North Carolina, so that you can connect directly with a master trainer close to you. And then the next sheet would be the sheet that you would need to turn into the North Carolina Board of Physical Therapy examiners, showing evidence that you did complete the course. And there are 26 cities or towns in North Carolina that have a master trainer for A Matter of Balance. There's a total of 61 master trainers, and as of the end of June, there will be 63, because we've got 2 coming to the Isothermal Planning Council. So we haven't had it. We've been having to be supervised by Land of the Sky. And like I say, most of the master trainers, like they talked about, the Area Agency on Aging, which is part of your Council of Governments, and getting connected with that group of people becomes very important. I just said the spreadsheet of all the master trainers has contact information, both telephone and email addresses for all the master trainers. You can contact them directly based on and then this is the sheet that you'll find in the that you'll need to have your master trainer sign off on. You can do the coach training can be 2 4-hour days, or it can be a full 8-hour day. So you may need to fill it out, have your signature. And a lot of times, because there's 2 people who are coach training, you may want to find a colleague who would want to go with you. So, and you can see right here the number that you'd need to fax it to get it to the North Carolina Board of Physical Therapy Examiners, so that they will know and you got evidence that you had that training. And then the good news is that the Tai Chi for arthritis falls prevention is approved by other states, and so as a result, it's approved in North Carolina for CEUs, and I think it's 16 hours maybe. I can't remember the exact number of hours. But all you have to do with that would be submit your certificate if you're audited. And so it is approved. There are 161 certified Tai Chi instructors in North Carolina. So to be able to find them, you can go to this URL and find all those from North Carolina that are certified instructors currently. And then, as Ellen briefly mentioned, CHAMP has been around now for 10 years. Dr. Vicki Mercer developed it 10 years ago in McDowell County as a part of a grant from a local grant. Anyway, so as a result, it's been here. We've used the STEADY, CDC STEADY Falls Risk Assessment, and then the OTOGA exercise program. And it has been expanded now to, well, we're still in McDowell County. It had been in Watauga. It's currently not in Watauga. It's in, it's going to escape me, High Point. There's Penny Burn, and then Caldwell County is getting ready to start theirs back up. And next year, it looks like Asheville, we're going to have our first urban center at a senior center. That's it's really falling in place. That's going to happen. So if you do 20 hours volunteer with that, again, you could get one CEU, and you would learn the different tools and how to implement them. And one of the things that I find really helpful is that the CDC STEADY, the assessments often match many of the exercises that are part of the OTOGA, so it's kind of like using the motor control theory, specificity. Whatever their weaknesses are, you can find the right exercise for them, and they come back in a month. The problem with referring our patients to community-based programs is that there's no magic bullet that's going to, because there's 100 different counties and the services are different in each county. Each regional area is different. So that's the good news that we have the healthyaging.com webpage that has the information there. The critical thing is if you become a trainer, make sure that you turn in your information there so that they can maintain the information. And then I've listed here, have a URL for all the 160 plus senior centers in North Carolina. Connecting to your senior center to identify what programs they have is very important because the senior centers of excellence are listed there. I'm lucky enough to work with the folks at McDowell, which is a senior center of excellence. As we'd mentioned, the Area Agency on Aging, and then I think it's a repeat on the Matter of Balance spreadsheet. Now, some other courses that are available, National Council on Aging they have approved or community-based programs, and this is a list of all the National Council on Aging falls prevention programs that they have validated their evidence-based programs. Many of them, well, some of them don't have exercise. They're more address fear falling and other, maybe depression, some of the other things. But this is the full list. You can find it on the web page up here. This is one that I thought people might find helpful. The CPT code flyer that they have, it's this page right here, but you can download it yourself. It's got all your ICD-9s, ICD-10s, your CPT codes, and if anybody's doing PQRSs, it's got your codes, and that might be helpful that address falls risk. And then one of the things that we currently, these are the current North Carolina evidence-based falls programs that I could find in North Carolina. And we already talked about a Matter of Balance. Bingo Size is one, Enhanced Fitness, Fit and Strong, of course, the OTOGA exercise program, Staying Active and Independent for Life, the Tai Chi for falls prevention, and the YMCA Moving for Better Balance. And the Bingo Size, it's more of a social program developed by the Western Kentucky University, but it does have some exercise element. Again, there's a fee you pay to do it, but it is in North Carolina according to their map. I couldn't find exactly where. Then Enhanced Fitness, and we're lucky enough in McDowell County to our senior center to have Enhanced Fitness, low cost. It addresses strength, endurance, and flexibility. It's offered at a lot of different places. I know our instructor teaches at the Y, and they pay for her to come to the senior center 3 days a week. They pay nothing to go to the class, this is where Enhanced Fitness currently is in North Carolina. You see it's more in Western North Carolina, and that's probably the Western North Carolina YMCAs, I think, have picked that up. And then Fit and Strong combines flexibility, strength, and aerobics. It's more for osteoarthritis. It's an 8-week program, but you see it in the Piedmont, Mooresville, Durham, Raleigh, Charlotte, but it is up in Boone, the Watauga area, Madison, and Troy. So if those are any places that you know and you can connect with them and possibly make a referral for your client or patient to one of these facilities. And then, of course, the Otega we've talked about. There's 329 PTs or PTAs who have credentials from the web page, according to the web page. So there's quite a few folks who've done that training, and I find the Otega very helpful. I almost wish that we had the Steady As You Go, the SEGO, which is the next step, community-based Otega, but I think it's not in the United States currently. And then the CEL program is, you can do it online, or you can have a 10 class written by, it was created by PTs. The online class, it can be 10 weeks, and you can, I'm looking at trying to bring this to North Carolina as an on-site class, because there's no, there's not a lot of fees attached to it, and it looks like it could be a program that could be very helpful. I know there are PTs in North Carolina who have been trained and are credentialed in this program, so look for that maybe next year in Marion. And then, of course, the Tai Chi for arthritis, we said 161 certified instructors, and you can find those there. YMCA Moving for Better Balance, 12 weeks. And this is pretty much, the Tai Chi class, but it's, I think it's a little lower, not quite as, maybe, the Tai Chi oriented. And this is, it's located throughout the state, Gastonia, Western North Carolina YMCA's, the Triangle, Southeastern North Carolina, Wilmington, Wilkes County or Northwest, and then Greensboro. So, and you can reach that information there. The other thing that I thought folks might want to know about, and maybe some of you already are members of the Geriatrics Academy or the APTA Geriatric section, but they have a monthly falls challenge that you can sign on and get once a month. They have research, evidence-based information on a particular topic in terms of falls prevention. Like this month, they reviewed the research that came out last fall about standard protocols for exercises for seniors. And when you join this group, you get to access all the Google Docs, and I think they've been doing it now for 3 years, and they have all the research for each month. So pretty impressive group of literature there. And then the last thing I wanted to share with folks is that our next Falls Prevention SIG will be September 10th, and the new oncology section has a falls prevention special interest group of the APTA, and we've been able to get Brett McLennan, who's a faculty member at Wingate, who's going to present for us on that one. So stay tuned on information about that. And then I guess it's time to open up for questions. Oh, we've got quite a few more people here. I'm going to have to check and make sure I've got everybody.
Great. Due to the fact that we do have quite a number of people on the line, and just for the audio possibilities, we're going to ask you to type in any questions that you might have into that little chat in the bottom of the menu towards the right, the control panel. One question did come in, and it states, how would you decide what program to refer your patient to? And we thought, Martha, as a physical therapist, we didn't know if you wanted to address that question first. It's a question of how would you decide which of the programs to refer your patient to?
I could do it, and then you might kick in. I mean, part of the issue is what's available, and you need to know your community. And then I think the matter of balance. The question I asked: do you limit your activity because you're afraid you might fall? Because it's all about fear of falling. And then Tai Chi, it's a higher level one that you would look at. So depending on their current status and their performance, I mean, that's why the CDC steady assessment is so nice. It does, one of the things that we do in that is the ABC, the confidence scale, and it dictates that whether they're within the norm of fear of falling or not. So those are some of the things. Having the appropriate assessment tool can help you identify the appropriate program. You guys maybe have other, and Vicki, you may want to speak up, and there's probably other people who have some other specifics too.
Yeah, that was really good, Martha. And also, again, the chronic disease self-management programs can complement anyone dealing with any type of chronic condition. So we always do recommend that too. But you're right, availability, what is close in proximity to where the person lives and what they're comfortable with are all big things. Do you have anything to add, Ellen?
And as Martha stated, really knowing your community and finding if you are in a place that's not offering anything, you can connect directly with your senior center and your area agency on aging, or you can reach out and we can help make that connection for you if you would like. It's also great if you could have a Martha Zimmerman in every county to have a great find your fall prevention champion in your area. That will really make a difference. So before I move on to the question, thank you, Skip. I see your question. Martha, you invited Vicki to respond. Vicki, would you like to respond to the question about which is finding the right patient or the right program for your patient?
Sure. So you've already kind of covered about the sort of spectrum from higher risk to lower risk and where the different programs fall on that spectrum. So I think that's an important thing to consider. I also think it's important to look at your clients' abilities and including their cognitive status. So if someone, has difficulties maintaining like a home exercise program, then Otago is not going to be good for them. They may need something that's more structured. So really just looking at physical and cognitive abilities and trying to match up what you know about each of the intervention programs with your client's abilities.
Great, thank you, Vicki. So we have a question here. It says some EMS services in the state respond to frequent fallers. Do any of those services refer frequent fallers to local community programs? So yes, I know of, for example, in Orange County, North Carolina, they have a really strong partnership with their health department and their EMS. So they have actively worked to get the word out about falls prevention programs. I think they're using magnets that when they're called to pick someone up at home, they're posting a magnet with information and follow-up information for falls prevention programs. In Madison County, in Western North, so Orange County and Central North Carolina, in Madison County and Western North Carolina, they just recently had their EMTs trained to lead a matter of balance, because they really have encountered a lot of frequent fallers who refuse transport and refuse additional assistance. And so they're trying to work to reduce those calls and to prevent more falls. So they've decided to start with training EMTs in a matter of balance. And also are working on, this is happening right now, so they're also working on figuring out the referral process. How an EMT can refer with consent from the patient into a community-based program.
We had another question come in to me in particular. It's asking about the June 7th Chronic Pain Summit. And I just wanted to mention that it's really about chronic pain and musculoskeletal pain, and it's focused on how evidence-based programs can address pain, as well as how to better create clinical community partnerships, whether that's with physical therapists referring, whether that's with the hospital system in place. And it's talking about marketing and communication to really raise awareness about management of arthritis and walking campaigns. It's going to be held from 10 to 3 in Concord, North Carolina, and there is a registration that is required, and I'm happy to send that out to anyone that might be interested.
Are there any other questions specifically for volunteering that Martha talked about that she could address? Hours that count towards CEUs, either for volunteering with CHAMP, volunteering with A Matter of Balance as a guest health professional, or leading either one of the programs that are approved for CEUs? Okay, we'll keep an eye on the chat box. And I just wanted to mention that I'm currently teaching in A Matter of Balance class, and the physical therapist who comes to do the guest health professional visit has found it to be really helpful in understanding how these classes work in the community. And he says it's one of his favorite things to do is to come out to the community class and show people how to fall safely if they anticipate their fall, and how they get up safely. So just wanted to share that little tidbit that I've heard from personally through teaching A Matter of Balance. So we got one question in for Vicki Mercer. When is the next CHAMP event?
I know that there's one coming up possibly at Caldwell on June the Friday, first Friday, the 6th or 7th. And then we've got one in McDowell, June the 14th. And I'm not sure that you can go to the webpage that's listed on here, and we'll be sharing these PowerPoints. And it has the list of all the CHAMP events, and it has the URL where you can go and sign up. There's a Sign Up Genius that you would need to sign up for. And we can send you a copy of the manual so that you'll know what would be going on.
Vicki, would you like to share a little bit about CHAMP while you're on? I know Martha gave a great introduction. Is there anything else that you'd like to add about expanding at North Carolina?
Sure. So we are looking to try to expand the CHAMP program to additional locations across the state, and CHAMP is actually going to be featured as sort of a model program as part of the AGPT and the NCOA task force work on falls prevention. So you know, we're excited about that, and to just be able to get this program out for more people. And I think it's ideal for the more rural areas or other underserved populations. So we're also excited to see what happens in Buncombe County with, you know, trying to reach an underserved population in a more urban area. I think it's really helpful for folks who may not have resources in the communities for teaching classes for like the Matter of Balance or those sorts of things, and it encourages the clients to really take ownership of the program themselves, because they are responsible for doing those home exercises on their own. And so from the very beginning, they see it as their responsibility versus, you know, a physical therapist or a PTA, you know, helping them get better, or, you know, treating them so that they get better through that interaction. So more ownership, I think, is a real plus to the program, and because it is really Otago program that we're using for the intervention.
Great, thank you. So we have another question that says, I'm a part of the NCPTA Diversity and Inclusion Task Force. Can you review with us where the most underserved counties are with respect to the availability of falls prevention and mitigation programs? That's a great question, and I wish I had an easy answer. Let me go back. You can often look at our, the map on the Healthy Aging page, but it doesn't always show all of the programs offered throughout the state. So there are programs in areas that are not on our map. So going back to show the injury and violence prevention branch map. So bear with me here a second. Wow, it's way back there. Here we go. So Skip, I would love to follow up with you with this question following the meeting as well. So this shows where the highest rates of unintentional fall deaths occur. You can see the darker rates that we highlighted earlier. This doesn't always correlate directly with being an underserved county in terms of programming. So there are a lot of factors that are influencing these rates. But there are counties where there are programs that still have higher rates. So I could get some county level data for you and work more closely with that task force if you're interested to look at the number of programs per county. I do have that available, but not with me right now. So if you'd like to follow up with me afterwards, I'd be happy to share that. But it is harder depending on how the senior centers and the area agencies on aging decide to offer these programs. Each AAA operates differently. So for example, one AAA may rely on providers in the area and not offer the classes directly, and another AAA may rely on all volunteers and lay leaders. And so the implementation is different across the different agencies. For some people, offering the program as part of their paid job as staff, and for others, they're constantly trying to renew their volunteer base. So that's why I think having this webinar is a really great start in increasing awareness for those of you that didn't know about these programs, and perhaps with PTs and PTAs becoming trained to offer these programs in your clinics or in the community if you do home health. So this is a great opportunity to increase sustainability and reach and availability of these programs, especially in the underserved areas. So thank you, Skip. I will follow through with that. And how do I do that? Our email is at the end. Oops, let's see here. At the end of the slideshow.
Or you can go to our healthyagingNC.com webpage and go to the contact tab and write in your information and your question.
And also to address Skip's question about EMS, the program that I was working in 3 years ago was working with the EMS for referrals after a client had fallen. And one of the things that we developed as a result of that, they ended up with what they called community paramedic group, and they're addressing a lot of the issues so that, to provide some of the services that they need, because you got the frequent fallers they call, and they just want to get them back into the bed or back into the wheelchair. Anyway, so that, looking at what the problems are becomes a real important one. And I know that Burke County, Grace Hospital is looking at a gerontologist. Well, their gerontologist has a residency program, and they're talking about starting up a bi-monthly falls prevention clinic, and they're looking for referrals from EMS ED. And so that would be for 65 and older. So there's a lot of different programs that are forming right now with falls prevention because of the need.
Yeah, thank you, Martha. And you reminded me to share as well that as part of the grant that I mentioned earlier in the webinar, through Mission Health Partners. Mission Health is the largest accountable care organization in Western North Carolina, Mission Health Partners, and they have 2 community paramedics that serve 19 counties. And so they are also working to identify falls risks when they visit patients in the home and share referral information about these community-based programs. So we're doing a kind of a pilot now in Western North Carolina to see how that's working with the community paramedics. But there are only 2 people to cover 19, I think they have 2 community paramedics to cover 19 counties.
We did get a question about the availability of this PowerPoint, and we did want to let you know that we will be sharing with Martha Zimmerman the link to the recording for this webinar, as well as the PowerPoint itself. And also Martha will be sharing an evaluation form for you to give us feedback. And really helpful to us because it helps to identify if this information was helpful, what was most interesting or most useful, and ways that we can continue to get the right information out to you. Martha, did you want to talk any more about that process?
Right. I sent that out in the email that gave them the information on how to get on to the webinar today. So it should have been attached to the file. And if they could complete those and send those in by the 7th of June, then I can send you out the certificates. If I don't receive it, I won't be sending out certificates. I'm a little confused right now because I'm still missing at least 6 people that I'm not sure who they were. So if you were, if your number, let's see, maybe you've changed. Well, I don't see them on here now, but
Martha, did you
I'm not sure who he is. And caller 1, caller 6, caller 7, caller 11, caller 12. If you could type in and let me know who you are so that I can make sure that I have record that you attended, that would be very helpful. And I should also let you know that we thought that the September 10th meeting would not be open to non-members. It will be open to non-members. I think there will be a fee that we might be charging, so I'm not sure. Anyway, that might be something folks need to know.
And Martha, Ellen and I do have the list of all the people who wrote their names into the chat box, so we can share that with you.
Okay, that sounds good. Good. Yeah. And the other thing, and I know this is something that's happening in the North Carolina Falls Coalition. I don't know how many of you guys know there is a North Carolina Falls Coalition. There are also now Regional Falls Coalition, and that's one of the big things that they're trying to identify where they are and who they are. Western North Carolina has a significant one. We just had a great workshop not too long ago. So there's a whole lot going on with the falls coalitions across the state. And I think the Triangle's got one. Anyway, there's maybe, Ellen, you know more about those than I do, but who all and where all. You might want to share with.
Yeah, I'm going to bring up the website. It's ncfallsprevention.org. And if you go to the About section and click on, so this is for the state Falls Coalition, and which meets quarterly. And there are also local and regional coalitions. And so if you click on that, you can see the different areas of the state where there are different levels of active coalitions, but there's contact information for each one. So this is also a great way to build capacity in the underserved areas, is to connect with people in your area who are doing this work. If you scroll down, you'll see there's the Eastern Falls Prevention Coalition, and covering these counties in the eastern part of the state with Mary Hall. High Country Regional Coalition is just now starting to be active again. So there's some new initiatives happening in the High Country area. So I encourage you to contact Nicole. So that's getting re-energized as we speak. They're going to be meeting in June. Metrolina, and Natalie Tunia is the contact person in the Metrolina region, which is here around Mecklenburg County. Piedmont Area Falls Prevention Coalition, also Laura Plunkett at the Piedmont Area Regional Council is doing a neat initiative with libraries. In the Northwestern libraries are starting, they've been trained, the librarians have been trained in a matter of balance. So that's going to help offer these programs in some areas that haven't previously had access to programs. And also Winston-Salem State was just awarded a capacity building grant in falls prevention. And so we're hoping to see some new initiatives and kind of re-energizing the coalition in the Piedmont area as well with that grant. So Region A in the far west part of the state, you could connect with Jeannie Matthews. The Triangle Falls Prevention Coalition has a meeting, I think, next week. So if you're in that area and you're not yet connected to them, contact Tricia here. And then the Western North Carolina Falls Coalition has a website here, and you can contact Cynthia. So we kind of keep track here of all of the regional and local coalitions on the state website. But a lot of the really good connections and referrals are happening in the local areas with those personal connections and partnerships. So I encourage you to reach out and connect to people in your area, or start one if you don't have one. Martha, is there anything else that you'd like to add?
I can't think of anything. If there are other questions, we could certainly field them, but
if you're curious of what's been happening at the state level, you can check out the upcoming meetings and the past quarterly minutes and presentations. We're currently working on a strategic plan for North Carolina for the next 5 years in falls prevention. So if you would like to be involved in that, you can go to the homepage and contact us, and we'll make sure that you're included in that that information.
If not, then that has been the presentation on community-based, evidence-based programs through Healthy Aging NC. This is Jeannie Dairaghi and
Ellen Bailey, and thank you very much to Martha Zimmerman for making this happen.
thank you.
thank you, everyone. Have a good night.
Hello?